welcome everyone to our live event, Make Medicines Work. Thank you all for your patience with us. A few notes before we get started. Si necesitas traducción en español para este evento, por favor marque el número de teléfono en la pantalla y en el chat, más el código y el hashtag. My name is ELEANA, and I am so excited to be here with y'all. As folks filter in, we're gonna get our program started because we have got a stacked agenda of incredible organizers and leaders on the ground and policy experts here to share with us how to make medicine work for all of us. Because medicines don't work if people can't afford them. With us today are Action Center on Race and the Economy, or ACRE, Center for Popular Democracy, People's Action, Public Citizen, and Social Security Works. Like I said, my name is ELEANA, my pronouns are she and hers, and I'm an organizer for the mental health justice team at One Northside in Chicago, and we're part of People's Action. I organized to make medicines work because when I was in college, away from home for the first time, feeling isolated and sad, I was abruptly cut off from my depression medication because insurance decided they would no longer send my medication out of state, and I couldn't afford to pay for it out of pocket. This created a really big barrier to me in my recovery with my mental illness, and really impeded me in my health. We all need and deserve access to medication when and where we need it. We'll have a few opportunities for our panelists to answer your questions throughout this event. We won't have a Q&A section at the end, so make sure that you're typing your questions in the chat. And we have folks watching out for those questions, and we'll make sure to communicate those back to our panelists and our speakers. Like I said, we have an incredible program ahead of us. I'm so excited for us to get started. So before we do that, I'm going to ask everyone to take one moment right now to share the link of this webinar on your Facebook and Twitter page using the hashtags #MakeMedicinesWork and #PeopleOverProfits. Okay, have you shared the link? Did you do it? Okay, I trust you, I trust you. Otra vez para personas que justo entraron a este evento, si necesitas traducción en español, por favor marque el número de teléfono en la pantalla y en el chat, más el código y el hashtag. All right, let's get into it, y'all. I'd like to introduce KERRI McBain, a phenomenal organizer from down home, North Carolina. Take it away, KERRI.
Thank you so much. I very much appreciate that. My name is KERRI McBain, and I'm a leader with Down Home, North Carolina. And I'd like to share a little bit of my story with you. That is my healthcare story. So approximately 2 years ago, I was near death's door. And the experience of that was as painful as the experience of trying to navigate the healthcare system and access even basic healthcare, along with life-saving medication. And that experience will stay with me the rest of my life. And so first of all, I would like to say that the power that Big Pharma has over the healthcare industry is as powerful and evident as it's ever been. And I don't think that you can even make a distinction anymore between the two. These industries have failed me, and they failed you. They failed our loved ones. It is now our time to step up to the plate and say, we will no longer allow you to abuse our bodies, our minds, or our wallets. And I say this I don't say this lightly. I say this with passion and with belief and with the idea that we can do better. And so my story is I was a server for almost 14 years in a little town called Sylva, North Carolina. You know, I was used to working long and physically demanding hours. And a couple years ago, I came home and I noticed that I was not feeling well. I was exhausted all the time. I laid on the couch. I could barely move. And I didn't know what was happening. I just knew that my health was not the way it should have been. And so that being said, all of my experiences led to, my hair falling out, dry mouth. I lost 50 pounds in 8 months. And when I finally got into my local health clinic called the Blue Ridge Health Clinic, my first appointment lasted 3 hours. And I was so thankful that they were there for me. And the diagnosis was type 2 diabetes. And how often does diabetes occur in today's health industry? All the time. And so, that being said, I found people that would take care of me and that wanted to help me. And I started off on 3 medications. Medications, 2 of them that I can't afford. 2 of them combined together, if I had to pay for them out of pocket, and thankfully I have medication assistance now, but if I had to pay out of pocket, would cost me almost $40,000. Thank you. And now I'd like to hand it over to Senator Millett from the great state of Maine, so she can share with you her ideas on how this is impacting her community.
Thank you so much, Kerri, for that story. Yes, so I'm honored to be participating in this discussion this afternoon. My name is Rebecca Millett, and I'm a state senator representing South Portland, Cape Elizabeth, and part of Scarborough in the Maine Senate. During my time in the legislature, 2 of the most pressing issues my colleagues and I have worked to address are the increasing cost of prescription drugs and the deadly opioid epidemic. And unfortunately, these 2 matters are closely related, and they are fueled by the same thing, corporate greed. Years ago, pharmaceutical companies, particularly Purdue Pharma, spent a small fortune convincing doctors that a new pain medication they developed was safe just to prescribe to all of their patients and had little risk of addiction. And that medication, the opioid OxyContin, was prescribed for everything from long-term pain management to post-operation recovery. But that promise of a safe medicine was an outright lie, and Purdue Pharma knew it. As a result, people across the country, including right here in Maine, found themselves hopefully addicted to a powerful opioid, even if all they did was take the medication their doctor had prescribed. The opioid epidemic has hit Maine particularly hard. In the year 2000, 60 people died from drug overdose. In the year 2010, 167 people died from a drug overdose. And in 2019, that number had climbed to 380. For 4 years in a row, Maine has lost nearly 1 person per day to opioid overdoses, peaking at 417 deaths in 2017. Addiction is a disease, and like all diseases, it doesn't discriminate. Families across Maine have been impacted by this epidemic, regardless of where they live, who they are, or how much money they make. Thankfully, there is a drug available that can reverse an opioid overdose and save lives. Narcan is available to everyday people as an easy-to-use nasal spray. Unfortunately, access to this drug is restricted because of its cost. Narcan sells for an average of $125 per package. For many families across Maine, that's a week's worth of groceries, it's heating fuel or gas for vehicles, it's money that needs to go toward rent or the mortgage. And so while addiction may not discriminate, pharmaceutical corporations selling a cure certainly do. And every day, people are paying with their lives. U.S. Secretary of Health and Human Services, Alex Azar, has called for the country's economy to reopen, despite the obvious risks to public health, citing overdose deaths as a reason. Secretary Azar wrote in the Washington Post, quote, "The economic crisis brought on by the virus is a silent killer. Estimates suggest that each 1 percentage point increase in the unemployment rate translates into a 1% increase in suicide deaths and a more than 3% increase in opioid deaths, which means this virus-induced recession will likely cause tens of thousands of excess deaths. We cannot allow the virus to impose intolerable costs in terms of drug, suicide, and alcohol deaths, foregone healthcare, and more lost jobs, end quote. But anyone who helps those fighting addiction knows that loss of employment is only one risk factor. And at the same time, Secretary Azar has the power to make Narcan and other overdose reversing drugs more affordable through enforcement of compulsory licensing of drugs, which would suspend the monopoly-specific drug makers' hold on life-saving medications. If the Secretary of Health and Human Services isn't willing to use the tools at his disposal to save lives now, in the middle of a national epidemic and global pandemic, when will he? The American people and the people of Maine need to know that when they need life-saving medicine, whether that's Narcan, insulin, or remdesivir, they'll be able to get it without breaking the bank. No one should die because they can't afford the treatment they need to live, but it's already happening. So I call on Secretary Azar to use his authority and the means it affords him to keep the cost of life-saving drugs affordable and to help save lives. Thanks. Back to you, ELEANA.
Thank you so much for that really powerful testimony, KERRI. That should not happen to anyone. And thank you for those really insightful comments on the opioid crisis, Senator Millett. We're now going to head over to LADON Love, the Executive Director with Spaces in Action, who's going to take us to the ground where Spaces just took action on this campaign in DC. And I believe we're going to roll a video.
Because we want to make sure and make clear that taking care of America's people needs to happen first when we think about the government. Yes, yes? And the government is not doing their job because they're more worried about big pharma and having a monopoly, and they're worried about their investments, which go over the needs of the people. Because right now, like with a marking of a pen, the government could change policies and make it so generic medicines can be done beyond just a patent that some corporation has and make them free, and either make it free or low cost to everybody in America. And I'm intentionally saying everybody in America because if you're in America and you don't feel good, you might make somebody else sick. So we need to make sure we're taking care of each other. Yes, yes? And medicine should be for all. Yes, yes? All right. So with that being said, the President and the Health and Human Secretary, Alex Azar, can make this happen. There were folks from around the country who have collected letters, and we're going to attempt to deliver those letters today.
We were on the front of Health and Human Services, and we had folks from multiple organizations, of course, CPD, People's Action, Social Security Works, Public Citizen, and others. And locally, it was ourselves, Spaces in Action, Long Live Go-Go, Don't Mute My Health, and some other organizations that were here. And we took this opportunity to, one, bring arts and culture to the process and have a local go-go band called Hitmakers Music Group who did music for us, and Ace, a local singer. And we also took this opportunity to let folks tell their story of why it's important to have medicine that is accessible and affordable for all people living in America. And we utilize that language on purpose because if one person's sick, we can all become sick. After doing our speak out and playing some music, a delegation went over to the Health and Human Services building to deliver the letters that have been collected from across the country, thanks to many organizations who are represented on this call and many voiceless who were part of the pursuit to get local letters to send to the Health and Human Services Department. Alex, I will call him Alex, did not accept our letters, but we read the letters in the lobby and folks told their stories there as well, because we need everyone to understand that this is a crisis, and we also need to have a space to tell our stories, and the solutions have to come from the community. And that is exactly what we worked on doing today. It was very exciting. It was very hot outside. I know someone said it was 90 degrees where there are. It's 94 degrees, but it feels like maybe 100. And it's just very important that we make sure that our voices get heard and that we keep elevating that there is no reason for medicines to not be affordable in America, because the government, the president, the Secretary of Health and Human Services has the power to make medicine affordable. People are dying. People are suffering. And everyone in America is a child of America. When your child is hurting, you make sure your child gets what your child needs. You don't put your child to the side. You make sure that your child is better. You make sure that your child has the support that they need. We as Americans, we as people living in America, have to stand together and continue to push this issue. It's not about the color of your skin. It's not about place. When someone is sick, they are sick. And we need to make sure that we keep elevating that voice to make sure that we make a change. And then the last thing that I want to say before passing it back to ELEANA or to the video is that we need to fight to make sure that we have the medicines that are accessible. And we also need to make sure that we're helping people to understand how to heal their body from the inside. So at our event today, we also had fresh produce that we gave out, and we are able to get those sources from local farmers. So how can we connect with local sources to show people how to eat differently, and also meet people where they are? People are hurting. How do we get them the medicines that they need so that they can maintain and also work to change the lives of the generations now and those are to come? So thank you so much, and I'm going to pass it back to ELEANA, and hopefully the video might be ready now. Thank you so much for giving me this space to share.
Thank you, LADON, for that super powerful report out. I am really jealous that I wasn't able to go, but I'm feeling super fired up to take action myself after hearing that the federal government has the power to give us the medications that we need. So if you're feeling fired up too and you want to take action with us right now, please go to makemediциneswork.com and add your name to the petition. There's also going to be a link dropped in the chat right now. I'm now going to move us over to Maurice Weeks from ACRE. Maurice is the co-executive director at ACRE, and he has many years of community organizing experience and is committed to creating equitable communities across our country. Over to you, Maurice.
Thanks, ELEANA. So as ELEANA said, my name is Maurice. I'm the executive director of ACRE, or the Action Center on Race and the Economy. So here's the deal. We live in a country where structural racism is the dominant force. And that means in all of our institutions, no matter what they are, structural racism runs the entire show. This goes from everything from education to housing to everything really that you can think of in the country. But few industries perpetuate the structural racism that's baked into our country like Big Pharma. You know, Black folks and other folks of color already have worse health outcomes in our society. And it's not due to genetics, as some on the right wing would have you believe. It's due to the societal factors that we put around them, from food options to pollution. Black people have twice the rates of hypertension, twice the mortality rate for diabetes. And medications to deal with these types of medicines that Black folks need have historically been jacked up by Big Pharma really relentlessly, not related to any science in particular, but instead because these diseases are things that impact people of color and other Black folks. And pharma knows that we have a society in which it's easier for them to get away with it. One company, for example, Eli Lilly, raised the price of an insulin by 585% from 2001 to 2005. So I'm here to burst the bubble that the effectiveness of their insulin did not get 585% better over that time period. They just decided to raise the price. And we're seeing this play out heavily during the COVID-19 pandemic. So Senator Millett is right that diseases and viruses don't discriminate, but this country certainly does. Our communities have worse outcomes, and it leads to them to either skip drug treatments altogether or split those medications in a way that makes them way less effective, especially for diseases that are pre-existing conditions. For the coronavirus, this leads directly to more death. And unfortunately, we're seeing that play out throughout the country right now. So in the coming weeks, ACRE is going to be releasing a report that helps to document all of the ways that pharma attacks and extracts wealth from communities of color. But our charge, all of our charge together, is clear. If we do not include the dismantling of structural racism in our prescription, no pun intended, of how to make medicines work, we're going to fail. And if we believe in racial justice and a fair society, we have to design a system, a public medicine system that works for the most vulnerable people. And with that, I'll turn it back over to ELEANA.
Thanks so much for that, Maurice. I think it's so deeply important that we understand, exactly like you said, how systemic racism is really baked into our pharmaceutical industry. So I'm seeing one question right now from the audience for you. And this person says, what can we expect to see in terms of racial disparities in access to a COVID-19 vaccine if the government does nothing and pharma corporations continue business as usual? What are your thoughts on that, Maurice?
Yeah, that's a fantastic question, and is one that is really important as we're hearing that we're racing towards a vaccine, and just knowing what I said earlier, that Black folks and other folks of color have been disproportionately affected by this virus. Look, the price that Gilead came out very proudly with for for a corona treatment was over $3,000. We know that because of economic realities for most people of color, that puts the medication out of range for people who might be on the lowest rung of their health insurance, or maybe have no health insurance at all. So right there, we know that a lot of people are going to be carved out of access to that medication. And we know whenever that happens, it's going to hit people of color the hardest. And I think another thing that we need to grapple with is, this country has a rough history, to put it mildly, with giving medications to Black folks that are not fully ready for market. And that's not something that we should use to lean into, any type of anti-vaxxing energy. But it is something that we need to reassure our communities that whatever medication that we have come up with very, very quickly is going to be safe for all of the folks, the people of color especially, to take. So if the government does nothing, we can expect pharma to do what they usually do when the government does nothing, and that is extract as much money as possible from the most vulnerable people in our economy. So I'll turn it back to you, ELEANA.
Thanks again for those really insightful comments, Maurice. I feel more grounded than ever that the fight to make medicines readily accessible to everyone is also part of the fight to dismantle structural racism in our country. So I'm going to take us over now to our wonderful panelists to tell us more about the policy opportunities for us to actually make medicines affordable and accessible. So I'm going to hand it over to Carrie Evelyn Harris from Delaware Alliance for Community Advancement. Over to you, Carrie.
Good afternoon, everyone. As Eliana said, my name is Carrie Evelyn Harris, and I am the Executive Director for Delaware Alliance for Community Advancement, which is an affiliate of Center for Popular Democracy. I'm excited to participate in this panel. Well, it was going to be a panel, but unfortunately, Alex Lawson from Social Security Works was unable to join us. So it will be a lively discussion between myself and Peter. I'm going to mess up your name, and I apologize. Marduk. Marduk. There you go. But it's an important conversation because, unfortunately, right now the prices of medications that Americans are forced to pay are making them make the hard choice between short-term bills and long-term health for themselves and their family members. And nobody, we all can agree that nobody should be forced into this situation. Peter and I will be talking about how we can create a new reality for ourselves and fellow Americans, because this is what is pivotal to making sure that we all are healthy, and all of us deserve to live happy and healthy lives. So just as a quick introduction, Peter Barduc helps partners around the world overcome high-priced pharmaceutical monopolies and secure benefits of science, technology, and culture for all. He has worked to yield HIV and AIDS medicine price reductions, new state access to medicine policies, and global shifts towards anti-counterfeiting policies that safeguard generic competition. He is the Director of Access to Medicines Program at Public Citizen. So Peter, if we can start with this particular question. Is it actually true that the federal government has the power right now to make medicines and treatments like insulin low cost and even free to everyone?
Our government has the power to make medicine affordable and available to all, yes. Medicines cost real money to develop, but the primary reason they are so expensive to the people is monopoly. Our government gives drug makers legal monopolies in the form of patents so they can sell drugs with no competition for many years. So prescription drug corporations are free to charge as much as any of us will pay to protect our loved ones. And of course, we'll pay anything. Big Pharma knows this and takes advantage of it. But the government can fix it. Donald Trump, Alex Azar, and others have power under existing law, 28 U.S.C. 1498 for one, or government use of patents, among other authorities, to authorize generic competition, which can radically reduce prices and save people's lives. Our communities could get the naloxone we need, as Senator Millett was talking about. We could help prevent insulin rationing. We could help prevent HIV and cure hepatitis C, but the government has to act and stand up to pharma. A second problem during the pandemic is having an adequate supply of medical tools. We are still seeing shortages of basic protective equipment. There's a very limited supply of remdesivir, the first emergency authorized COVID treatment, which Maurice was talking about. And should one of the many COVID vaccine candidates prove safe and effective, there will be rationing as well, and perhaps the rich will buy their way to the front of the line unless we speak out. The government has power to publicly manufacture tests and treatments, masks and vaccines under the Defense Production Act of 1950 and the Pandemic and All Hazards Preparedness Act of 2006, among other authorities. The government can use its several existing public production facilities managed by BARDA and DoD. We can build new facilities. We can commandeer corporate capacity, install public equipment, or order corporations to produce according to need. All of this under existing law. But further, the same power I mentioned to authorize competition and license patents also can be used to expand supply. Generally speaking, more manufacturers, more potential supply. So we can break the monopolies and start making sure today that the medicines we need are being produced at scale and in sufficient supply to meet need. The government can make medicine affordable and available to all under existing law if it uses its public power and stands up to pharma.
So just to be clear, what you're saying sounds great, and I can think of, and I'm sure everybody listening can think of people in their immediate circle that can benefit from us taking away these patents and making prescriptions more affordable. But the question is, how is it realistic? How is it that pharmaceuticals are going to be able to recoup the costs that they put into research and development? Won't it make it harder for us to get the medications we need if we eliminate their ability to make money?
No. Drug development is expensive, it's true, but we the people invest in much of the riskiest early stage research. Just about every new medicine over the past decade, introduced over the past decade, benefited from public funding and public science before it was put on the market. So take remdesivir. Federal scientists and agencies were partners with Gilead at every stage of that drug's development. Federal scientists led the team that first discovered the drug. The Army tested it against Ebola, and NIH is running the major clinical trials today. At least $70 million so far in taxpayer dollars supporting the development of that one drug. Taxpayer dollars support the public National Institutes of Health, which invest $40 billion annually in biomedical research. We then license the promising medicines out to corporations to further develop and market the drugs, and we give them a monopoly. Now, during the pandemic, this is even more true because an agency called BARDA, which we were protesting in front of today, is giving out hundreds of millions each to the big pharma corporations to support their manufacturing and development costs. In other words, now the public is funding both the risky early stage research and the expensive later stage development. So we need to ask what we, the people, get for that investment. We should get affordability, we should get plentiful supply, and we should get sharing of the knowledge and technology involved in the products so that others can make the products too. Qualified manufacturers at work can make the products too. The companies involved invest in R&D also. And to be clear, we aren't saying we shouldn't pay. We're saying we should not pay monopoly prices. We can and should pay significant royalties, contributions where corporations have done a lot of R&D. Investors still can make their money, just not monopoly money, because monopoly prices aren't needed to support drug development, and they lead to rationing and suffering for people who don't get the medicine they need.
So when I hear you say monopoly money, it feels as if a game is being played with our lives, right? You have explained how the veil, you basically pulled the veil off of the fact that profit-making strategies of big pharmaceutical companies are used to increase their profits, while the rest of us are forced to make life and death decisions based off our family budgets. How is it that the pharmaceutical companies are able to get away with this?
It's power and it's money. It's lobbying. The pharma lobby has 2 lobbyists for every member of Congress. If you can imagine that sort of power walking the halls of Congress every day. And it's because, of course, people need to organize and stand up to push back against this. For a long time, it's been accepted conventional wisdom in Washington, D.C. that you can't really challenge pharma. And over the past 5 years, we've seen dramatic change there as the tide has turned from pharma sort of being able to pass most of the legislation at once and people like us struggling to keep up to a point now where we are starting to pass legislation that can just barely begin to bring medicine prices down. But there's so much more that the government needs to do and has the power to do today. And we took, we started today with people down outside HHS, with LADON and Spaces in Action DC, raising our voices, making clear what we want, with Senator Millett and the more than 24 other state officials who wrote into Secretary Azar already to say, we expect you to use the power you have under law to help us through this crisis.
Thank you again, Peter. I've been in this for a while, and I often get angry and feel bamboozled, and I'm imagining that those of you who are just learning this are feeling the same way. For decades, we've been hearing the narrative that pharmaceutical companies need to recoup costs in order to stay in business. And as a result, as consumers, we just go along for the ride because we think, what choice do we have? And so you mentioned this before, but I just want to come back to this moment of COVID-19, this moment where we've seen the brokenness in our system. What is it that we can expect to see from pharmaceutical companies in this time of COVID if we don't take action now? And we only have a short time. So what are specific steps that those who are tuning in with us right now can take to make it so that we can actually live through this COVID crisis?
We will see from corporations monopoly pricing and limited supply. There's a very real danger of rationing of treatments and vaccines. In fact, it's almost inevitable in the case of vaccines unless we fight back and win, which we can do. Government has power to change up, but we've got to fight back. So there will be high prices. There won't be initially enough to go around. People will be waiting. Communities will be suffering as we're waiting for the breakthroughs and as people lose employment and insurance. So there's a lot that we have to do. And the first step is, of course, being with us here today, joining this campaign, joining up with Center for Popular Democracy, People's Action, all the groups on this call, and helping us out. We will take this fight to the government. We will take this fight to Donald Trump and the pharma, and we will win.
Yes, Peter, that's the part that all of us have to take in. We will win. We will do it. We will stand in solidarity. There is strength in numbers. You're not alone in this. If you are someone who is currently rationing medication, know that there's a whole army out there waiting and fighting for you. And if you can't fight for yourself, we'll fight. And if you can fight, please join the ranks, because together we will win. At this time, I want to make it a point again to say that at this exact time, you can take action by visiting makemedicineswork.com. That's medicines with an S, to send a direct message to Secretary Azar to say it's time to end big pharma monopolies. That's makemedicineswork.com. We do have a question here, and it is, has the federal government ever used tools to curb monopoly licenses and high prices before?
Yes, in the 1960s, it was relatively common. It's also common in the non-pharmaceutical sectors. The Department of Defense, for example, does it pretty frequently with even things like night vision goggles. We're not going to hold back our defense strategy because of patents, and we shouldn't hold back our health strategy either. In 2001, the Bush administration, the George W. Bush administration, invoked some of these powers, and merely by addressing it in the context of the anthrax crisis and saying, we may take away your monopoly. The pharmaceutical company that was selling the remedy cut its price in half within a week. So these tools give the government a very significant leverage for all kinds of better policy and outcomes, but really do have to lean in and use it.
Excellent. And so we're going to transition now to our next speaker. You know, we have seen this affecting everyone in every state of our union. And it is important for us to hear from people all across our union to understand that, again, as I said earlier, we're not alone. And so before I transition, I want to thank you all again. We look forward to standing with you in solidarity as we fight this fight and we win at the end. And now I'd like to introduce one of our special guests, all the way from Alaska. To join us is ERIN Jackson-Hill from Alaskans to Take a Stand. ERIN?
Hi, thank you so much. I appreciate the opportunity to be in this space. I am ERIN Jackson-Hill. I am residing on the indigenous Dena'ina lands, otherwise known as Anchorage, Alaska. I come to activism through my path with addiction. And my path started relatively late in life. And I found myself a practicing alcoholic, and I had lost my job. And just before I lost my job, I had been diagnosed, I had had a mental health diagnosis and had gone on medication. The medication helped stabilize me, but unfortunately I lost my job anyway. After I lost my job, I of course lost my health care, and I lost my access to that medication. I heard somebody mention rationing medication. I did that for as long as I could, and then I went off of my medication, and it was a quick spiral. Within 2 months, I was fully blown in my alcoholism, and 3 years ago, this month, I tried to commit suicide. And it was because of, in Alaska, I could not get into a treatment recovery program. And it was because of the fabulous healthcare in Washington State and the fact that I have a very supportive family that I was able to go down to Washington State, get in treatment, get on my medication regimen because of AppleCare. And I sit here now 3 years into recovery and knee deep into this effort to try and make medication available for everybody. I can't stress how important it is, not just to me. Without my medication, I wouldn't be here. I'm lucky now, I have insurance, but my medication still costs $200 a month. That's with insurance. And if we don't do something to make these medications more available, I don't know if I'll be here next year. And there's a lot of people that are just like me that won't be able to afford their medication. And the flip side of not being able to afford your medication for some of us is death. So I really appreciate everybody allowing me to share my story. Um, it's been really, really powerful to be here. And with that, I would like to go ahead and introduce the wonderful Mandela Barnes.
Hey, everybody. I'm Lieutenant Governor Mandela Barnes, and I just want to say thank you for that powerful story, Erin. Obviously, these things aren't easy to share and certainly can be easy to deal with. But unfortunately, there are many stories like that. And that's why we're all organizing. And that's why we have to do everything that we can in our power to make sure that there are fewer and fewer and fewer until there are no more stories like that, because that should not be the reality of the most wealthy nation in the history of the entire world. So again, I'm glad to be joining you to talk about this important topic. As everybody has said on the call so far, nobody should have to suffer because they can't afford life-saving prescription drugs. That's the reality that we should live in. But unfortunately, for too many families, especially in Black and Brown communities, who are already less likely to have quality health insurance, and they are already being, or excuse me, are also being hit the hardest by this pandemic. Here in Wisconsin, our case numbers began to trend downward in early to mid-June, but unfortunately, over the last few weeks, we followed the national trends, and now our daily case numbers are on the rise again. On the 4th of July, we reported our highest ever daily increase with 738 new cases. And in fact, according to the Atlantic's COVID-19 tracker, not only does Wisconsin rank as the worst state in the nation in terms of spreading the virus, we are by far the worst in the Midwest. And as the saying goes, when white America catches a cold, Black America gets the flu, gets pneumonia. And in this case, COVID-19 is the impacts of COVID-19 are being felt tremendously worse in Black and Brown communities. And since the beginning of this crisis, Black and Brown Wisconsinites have been more likely to get sick, require hospitalization, and unfortunately succumb to the virus. Our Black and Latinx population makes up under 14% of the state, but together account for 46% of confirmed positive cases and 36% of COVID-19 related deaths. And we've been grappling with these racial disparities in health and well-being in our state for years, so it's not necessarily a surprise that the pandemic exacerbates those, but it's creating even more urgency for people to address them all across the state. Now, unfortunately, our GOP-controlled state legislature has refused to take any action to make healthcare more accessible to the people or to make prescription drugs more affordable. Democrats have proposed legislation that our administration supports that would cap the cost of insulin copays, but the bill did not even get a public hearing. And here in Wisconsin, we're still one of just 13 states that has chosen not to expand Medicaid under the Affordable Care Act. We know that expanding Medicaid in Wisconsin will not only provide about 80,000 people with quality and affordable health care, it will save our state $324 million in tax dollars, something that's in short supply as we grapple with the pandemic. And it would also bring in $1.6 billion in federal aid. And the worst part is that Medicaid expansion is clearly what the people of our state want, with over 70% of Wisconsinites supporting it. But our, again, Republican-controlled legislature, the gerrymandered legislature, they no longer have a will to listen to the will of the people. And that's why our administration is creating a People's Maps Commission, which is a nonpartisan body comprised of people of the state, not elected officials, lobbyists, party officials, and they're going to be charged with presenting these new maps to the legislature for consideration, because this is the only way that we can have our elected officials actually be accountable to the people that they were elected to serve. But we absolutely need the federal government to be accountable to the people as well. Pharmaceutical companies like Gilead continue to receive millions in federal tax dollars for their research on COVID-19 medications, vaccines, and other drugs, but the federal government isn't making sure that these drugs will be accessible for the people who are going to need them the most. And we know that Gilead plans to price gouge Americans by charging $3,000 for a patient for a COVID-19 medication that cost them $10 to make, after they've already received $70 million in tax incentive to develop the drug. But we have to put a stop to this. So Health and Human Services Secretary Azar, the Trump administration, and Congress have an obligation to do everything to increase the supply of critical medications, because we're facing shortage on insulin treatment, Narcan, and other COVID treatments. And Secretary Azar needs to issue compulsory licenses to stop big pharma companies from monopolizing the market on life-saving medications. This is the only way that we ensure people get the health care that they deserve, medications that they need, not just to survive this pandemic, but to actually live happy, healthy, and productive lives afterwards. And thank you for having me.
Thank you so much to you, Lieutenant Governor Barnes, and thank you so much to you, ERIN, for sharing that really powerful and moving story. As someone else who's struggled to access the mental health medication that I've needed, I know just how incredibly damaging that can be. So we are so happy to have both of y'all in this fight with us, and we have a few minutes to address a question or two from the audience that will be directed towards Lieutenant Governor Barnes as well as Senator Millett, who's still with us on the line. The first question that we have, and I think that this can go to both of y'all, so maybe we'll go to Lieutenant Governor Barnes first. Does this issue look differently if you're looking at an urban community or a rural community? Do you see differences like that?
Well, there's definitely a difference, but it's different. It's different in so many ways. I always talk about the access gap, and sometimes where healthcare is affordable, it's not always accessible. Where it's accessible, it's not always affordable. And if you look at a rural community, and there was hesitance in more rural areas from leadership, local elected officials, when we implemented our Safer at Home order because they thought that the disease wasn't spreading, but we want to be preventative because these are areas where the healthcare system can be easily overrun, areas where people have to travel 45 minutes to an hour plus multiple hours just to get an appointment to see a doctor. And that would create a catastrophic situation in more urban areas and more densely populated areas. You also have the potential to see more crowded waiting rooms, crowded emergency rooms, and an overwhelming of the healthcare system. And these are areas where it also may be difficult for folks to afford to have the healthcare that they need. We're talking about people who may not have a primary care physician, people who use an emergency room as primary care option, which isn't an option at all, just because of the access is not available to them.
How would you respond to this, Senator Millett?
I definitely agree with Lieutenant Governor Barnes. It looks different, but everyone's still struggling with the overall issue of affordability. And certainly in rural Maine, access is a huge problem. Poverty is a problem. And we've seen the opioid epidemic spread across the state, and it does not matter where you live in rural, urban, upper income, lower income. It's just been devastating. And whether you're trying to access the healthcare system through public healthcare or even your private provider, the costs are just prohibitive. Someone mentioned earlier that even after health insurance, there is still a $200 cost, which is just obscene. So we are struggling. We're working very hard as a state to make Narcan available through our police departments and our emergency rescue teams, but we know that these overdoses are happening in homes, and it's often too late when our emergency responders arrive. And it's critical that for families who know what they're struggling with can make sure they have in their home a very easily usable antidote to the overdose and save parents' lives, not leave children homeless and having to live with other members of their family or worse.
Thank you again to everyone who spoke on this incredible live event. Thank you to those in the audience for your really incredible questions. I am so fired up to take action in this moment. We have the solutions and answers to what our community needs and how to make medicines work for everyone. So take action with us right now by going to makemediциneswork.com and signing your name to the petition. This campaign is just getting started. This is the beginning, and we have so many more opportunities to take action in store. So make sure that you sign up so that we can keep you engaged and can send you updates about how you can demand that our government make medicines work. Thank you again for joining us this afternoon. We are so glad to have you here in this fight with us. Like KERRI said, we will win. We are stronger when we are together. So until next time, be safe, be well, enjoy the heat. See you later.